From CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. New surgical technology is revolutionizing the way complicated surgeries are being done. The perfect example is the Vinci Surgical System. Dr. Victor Dabelea tells us why he prefers using this advanced surgical robot over traditional surgery.
We have a patient with big fibroids. These are benign tumors on the uterus, and they are quite big, occupying the pelvis and the lower part of the abdomen. She has lots of symptoms because of these fibroids, and she wants to proceed with a hysterectomy.
What with the robotic surgery are we able to do that's different than traditional surgery?
So with the robot, we'll be able to do a hysterectomy on a patient with a very big uterus using just 5 small incisions versus having a laparotomy, that means opening the abdomen with a big incision. Are very precise with the robot. Is less invasive, less trauma to the patient, so they recover very well and very quick. Full recovery is expected to take about 1 to 2 weeks versus 4 to 6 weeks if you do an open hysterectomy. I used to do laparoscopic hysterectomies with conventional laparoscopy. Since I started to use the robot, I'm convinced that this is going to be the future. We are more accurate, and we have less chances that we'll run into complications, less chances that we'll end up with an open procedure. We are more precise, and recovery, it's great.
Dr. Victor Dabelea from Summit Women's Care joins us today. Thank you for being here, doctor.
Thank you.
I, like many women, have had the traditional surgery. This robotic surgery is so exciting. How can women make sure, or men, that they get this type of technology?
Well, this is another option for performing surgery in GYN, urology, urogyn, or general surgery, and the use of this advanced technology is great because there are a few great advantages, like being more precise, having 3D view while you are doing the surgery. You are more accurate in performing the surgery, less trauma to tissues, more precise in controlling the bleeding, and the instruments are great.
I was in the operating room with you, and it was amazing because the tools that you used, if you could go ahead and show us, they have amazing abilities.
So this is one instrument that we use in robotic surgery, and it has a wrist motion like here, where you can see the tip of the instrument can move in any direction you want. It opens, it closes, it moves left and right, and you can control all these motions of the instruments from the console, and is very precise.
Show me the traditional.
With traditional, you don't have this possibility of wrist motion, so you can just open and close, move left or right, and spin. Also, if you want to go, let's say, perpendicular on a tissue, here I have to have the whole instrument perpendicular to that tissue and grab it. With the robotic instruments, I can get close and just bend the tip of the instrument 90 degrees.
And I saw that happen. It was twisting and going everywhere you wanted it to go.
Exactly, and it's very precise. The robot is downscaling my motion. Let's say if my hand will move 4 millimeters, the tip of the instrument will move 1 millimeter. It's going to filter my tremor, because we all have a little bit of a tremor. It's natural. So the robot will filter that. So we are way more precise in our doing the surgery.
So we want patients that are interested in this type of technology, they need to let their doctors know and go to physicians that perform this, correct?
That is correct. Robotic hysterectomies, and as I'm a GYN doctor, this is my focus. It's about 30% of the cases still in the U.S.
Thank you, doctor.
Thank you.
You can always go to our website for more information, to take today's poll question, and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.